Good afternoon, Jess. Would you like to come off mute and just test your audio real quick?
Hi there, can you hear me?
Yes, we can. Thank you. Good afternoon.
Good afternoon. Thanks for having me.
Thanks for joining us.
I have started the stream, just so you guys know.
Good afternoon, Donna. How are you?
I'm doing well. How are you guys?
Great. Thanks for joining us.
Check that out and play the song that isn't even released yet. So if you want to hear some brand new playground music before anyone in the rest of the world hears it, that's tomorrow at noon. It's 9 a.m. Pacific.
Well, we'll get started in just a few minutes. I know we're maybe waiting on, do we know Bethany or Elaine? Are we waiting on a couple more people? Have you heard from others that they can't make it?
I don't know if Christy or Leah responded to, oh, there's Leah.
I was going to say, I believe Leah was joining. Christy will not be on anymore.
Oh, okay. Thanks. Good afternoon, Leah.
Hello.
Thanks for joining. Brooke, I think then that's good to go.
All right. Well, welcome everyone.
Hold real quick. Did we get the live stream going? Are we live streaming or just recording?
This is being live streamed. It is on
Okay.
YouTube Live right now.
Okay, thank you.
Great. I'm Brooke Lawson. I am one of the co-chairs of this subcommittee, the Children and Families subgroup. And before we get started and get into the business of the meeting, I did want to take a minute. I know if we were all in person, we would have an opportunity to connect a little bit. And that's one of the things I miss most about having meetings in person, is being able to connect with all of you. And so I really believe in practicing what I preach, and I think connections are important to work. And so I wanted for us to, when we're doing our introductions today, to go ahead and introduce yourself. Tell us what your role is. And then I'm going to steal something from my favorite social worker, Brene Brown. And so whenever she holds a meeting, she always asks her staff to do a 2-word check-in of where they're at. You can do that about how you're feeling, a 2-word check-in about what's going on. So I'll go first while all of you are thinking, and then I'll actually call each person out because I know that can be a little awkward here in Zoom. So I'm Brooke Lawson. I'm the Mental Health and School Counseling Coordinator for Hamilton Southeastern Schools. And I will say that my 2-word check-in, it's actually just a 1 word for right now. It's been busy. So I will kick it to Elaine.
Oh gosh, I'm just here to support, but I would say, in all honesty, inspired and tired.
Great, thanks, Elaine. Bethany.
Yes, hi everyone. Like Elaine, I'm here to support, but I am Bethany. I'm the School and Community-Based Programs Director at DMHA, and I am feeling very grateful and a little bit distracted. I'll just give you a heads up. I am driving, but I'm going to be here present as much as I can be.
Great, thanks, Bethany. Rachel.
Hi, I'm Rachel. I am the Deputy Director and Chief of Staff for the Division of Mental Health and Addiction. And I would say excited and motivated.
Thanks, Rachel. Jess, I know, Jess, you're new to our group, so welcome.
Oh yeah, thanks for having me. I apologize I can't be on camera like Bethany. I am in transit as well. But my name is Jess Yoder and I am the Project Aware Specialist from the Department of Education. So I suppose that leaves me as a representative on the more education side of things. My 2 words right now are hot. I just walked to my car and my goodness, it's so hot outside. And oh gosh, I'm going to be honest, concerned. And I could go into depth with that, but I won't. So those are my 2 words.
Thanks, Jess. Donna?
Hi there, I'm Donna Cully. I'm a clinical psychologist and the Director of Child and Family Services at Southwestern Behavioral Health Care. And I think I love I can't remember who it was that rhymed. They said inspired and tired. I'm going to follow suit with my best poet. I'm going to say I'm blessed and stressed.
Great. Thanks, Donna. Leah?
Hi, sorry, trying to get off mute. So I'm also in transit, but almost to my destination where I can plug in. And so the first word that came to mind for me was busy, but also motivated. So I guess busy in a good way.
Great. Thanks, Leah. All right. Well, we will just jump into our meeting agenda. I know all of you received the minutes from our last meeting, which seems like it was so long ago on April 28th. But I wanted to offer an opportunity for anyone to add anything that they would like to add or correct or ask any questions about those minutes before we move on. And since I can't see hardly any of you right now, I will just ask that if everybody's comfortable, we can go ahead and someone make a motion to approve the minutes.
I so move. It's Donna.
Great. Thanks, Donna. Does anyone second?
Hi, this is Leah. I second.
Thanks, Leah. All in favor?
Aye.
Hi.
Wonderful. Thank you all. So Chase Lyday is also one of the co-chairs in this committee, and he was unable to join us today because he's actually got another subcommittee meeting going on at the same time. But Chase and I, after reviewing the notes and having some discussion, tried to take kind of the conversations that we had in our last meeting and kind of organize those into 3 different bucket areas that we wanted to have some discussion with all of you about today. So you've seen those on your agenda that you were sent earlier this week, but really, I would like to offer an opportunity during this time to kind of share the buckets with all of you and have some conversation as a group about each of those buckets. So the first of the 3 buckets is really just access to behavioral health services for all Hoosier children and families. And we kind of took all of the conversation that we had in our last meeting around the need for more outpatient services for children and families, the gap in services from outpatient treatment to inpatient treatment. So the need for intensive outpatient programs, partial hospitalization programs, things of that nature. And then also just the concern around the number of available beds in the state for our youth when they do reach that level of needing inpatient care. So I'd like to offer, an opportunity for you all to share about your thoughts about this bucket, what questions you have, or if you feel like we've missed anything when it comes to behavioral health services for children and families.
Brooke, is school-based included in outpatient?
Yeah, that's a really good point. Yes, that's what we were thinking, but we probably need to be specific about that.
I think, I'm not sure how this fits, Brooke, or if this is for further discussion, but the only thought I had as it talks to whole child education is somehow linking that to the why it can also lead to better academic outcomes, right? So tying it back to, and I'm probably thinking more about the context of the world today as we have this discussion, but how whole child education can link to better academic outcomes too. And I don't want to miss that point.
Yes, yeah. Leah, save that thought for that bucket discussion, because I definitely agree with you. There's lots of research that supports whole child education and how that really is foundational to high academic achievement.
Yeah, I think my only point would be that I think it could be incorporated into one of the bullet points here, if this is going to be distributed more broadly at any time.
Yep. Thank you.
Yep.
Donna, I don't want to put you on the spot, but I am interested in your thoughts on this one, especially since you are kind of one of our representatives from community mental health. Do you feel like we're missing anything here?
For the most part, the major areas are covered. I also sit on, and I'm going to block on the name of this subcommittee that I'm on, that relates to the 988 for children, the whole kind of suicide crisis, mobile crisis options for kiddos and families. It's not really reflected here. I'm not saying it should be, but I know that I'm having conversations with sort of an additional group outside of this group about those specific issues related to crisis and suicide, and how we as a state are developing services and responding to that issue for kiddos. In that body of work, they do address prevention. I think it could get unwieldy, and then we may have another subcommittee actually that's looking at prevention work. I can't remember now all the subcommittees that are associated with the larger group here. The only thing I do notice, Brooke, is that under the whole child education, there's a bullet for funding slash positions to support this work. And when I think about barriers to access right now, and maybe it's just, and of course it's every CMHC, it's every provider, it's every service entity struggles to get the positions filled. We have so many vacancies, and part of that relates to the underfunding of mental health services in general, not just for children, but in general, the devaluation of mental health is reflected. And I think all of that kind of does speak to access. I'm not advocating for additional bullets necessarily, but just for discussion.
Yeah, you brought up 2 points that I want to circle back to. Number one, as a school system, we noticed a large gap between like when a student is discharged from the hospital. So, maybe after they might have accessed the mobile crisis unit, but when they are released from the hospital and that transition back to services, and especially back to school, in our school district, we really felt like there was we often wouldn't have a lot of information about what had happened when the student was on the unit and how we could support the student in transitioning back to school. And sometimes school was the environment that caused a lot of the stress for that student. And so I guess I'd love to hear people's thoughts on, like, when we think about the crisis services, do we need to add something to this bullet around crisis services and transitions support?
Brooke, what came up for me as we were talking about that would be, I think, utilizing people with lived experience in the realm of youth is somewhere where we have a lot of opportunity for growth. And I'm thinking in particular for that we're able to mobilize when youth are transitioning, between levels of care, or, we're working to keep them stabilized, that could be something that would be really helpful.
Yeah. Are you aware, Rachel, of anyone that's using youth in that role?
I am not off the top of my head. Amy Brinkley on our team in DMHA is our resident peer expert. So she would be able to, I'm sure she has her thumb on the pulse of what is happening.
Mm-hmm. Great. And then Donna, to your statement about funding and positions to support this work, I hear you on the access to providers and the need versus the number of providers in the state. And when Chase and I were talking through that bullet, we were really talking about funding and positions really for schools to expand the number of school employed providers to support students. So a lot of times that becomes a funding issue. Schools don't have the ability to hire school counselors or school social workers or school psychologists. And so that was something that we were considering for that bullet.
Hey, Brooke, I have a thought about the first bucket.
Mm-hmm.
When I think about access, a lot of the conversation has been kind of circulated around, personnel. You need personnel in place in order to have access. You need the workforce. You also need like the physical beds and the physical space.
Am I the only one who can't hear Jess right now?
I lost
I
her.
cannot hear either.
Okay.
Can you guys hear me now? I'm so sorry.
Oh, yes.
Yes.
Okay. I think my phone tried to hop on a Wi-Fi, which is, it has its own mind. Where did I leave off?
You're talking about physical space.
Yeah. So like workforce, physical space, that's obviously a huge issue that we need to talk about. But if we were to solve those problems, I think the referral process also needs to be talked about. So how are we routing children and families to these services? Whether that be an existing relationship or an MOU between organizations, or, existing kind of meeting spaces where people can talk about referrals and also have different kind of routes for referring. I think that's also something that I think about when I think about access.
Mm-hmm. Yeah, well, and as you brought that up, Jess, I was thinking about the lag time between referral and actual intake and how sometimes that can really be difficult for families.
Yes, I agree with you.
Brooke, the other gap, as you two were talking about that first bucket, that came to mind was also for those who qualify for Medicaid and those who don't.
Mm-hmm. Mm-hmm.
And I don't know if that's outside our scope, but certainly a gap on both sides.
Yes. Yeah, and the level of services that students with private insurance or children with private insurance have,
Yep.
The supports and services that children with Medicaid may have access to.
Right.
I'm interested in others' thoughts around that statement.
Well, I certainly, would support this group addressing that, because that is something that we experience. I mean, I have some staff who are working with clients in a school setting in 3 of our 4 counties down here. But it's only those students that have Medicaid MRO. We tried it. We tried to put staff who have LCSWs and who are able to take private insurance in a couple of schools. We never were able to sustain those positions because we never got enough referrals. But I know that there are kiddos that have commercial insurance who need services. But right now, I mean, we have to almost define our program eligibility related to those students that have MRO, because that's the only funding mechanism that we have. And we don't have a financial arrangement with any of our school corporations to pay for services out of a different bucket. So I think that is a huge access barrier, and one that if we could, figure out something to support all students across the spectrum and, regardless of insurance type, that would be a wonderful bit of work.
Yep. I certainly agree with that. In our school district, we only have licensed providers because we have such a large number of students with private insurance. And so I know that those types of programs like that can be difficult to sustain. All right, so it sounds like we may make some shifts and edits to bucket 1. Let's move on to bucket 2 around appropriate models to restorative discipline approaches. So as Chase and I were kind of trying to think through and formulate some of the conversations from our last meeting, we talked about the need for moving away from zero tolerance policies, not just with schools, but in general. We talked a little bit about JDAI and alternatives to detention. And so including, we wanted to kind of identify this moving away from zero tolerance policies to including behavioral health supports, whatever that looks like. We were talking a lot about programs like Fisher's Youth Assistance or the Youth Assistance Program in general, where there are organizations that are able to come alongside families and help them kind of identify some of the barriers and find the right supports for their student, which could potentially include behavioral health supports, but more of like some type of case management type service to support. And then also including more training for all organizations around using more restorative approaches when students are, or when youth are struggling. So I would be interested in some conversation around this bucket and your thoughts with that, comments, questions.
My only thing is, as we make this recommendation, anything that we can do to link it, any sort of concrete successful for students, especially students that are experiencing disparities otherwise, I think would be really helpful. I think I think if this isn't your area of expertise, these kind of terms like restorative discipline can feel kind of nebulous to folks. So I think anything that we can do to help define it clearly, to make it accessible to people who are not familiar, would be really helpful in terms of developing buy-in and support.
Mm-hmm.
I agree. I was thinking more like, is there a way to link it to preventative or proactive models for, our developing youth who may be in need? And I will be one of the non-clinicians here who would, need that help of understanding. But I think something around more of that proactive or preventative or rehabilitation kind of language.
I love that idea, the more like proactive approach.
Mm-hmm. Or even collaborative too, is a good description of what you were describing, I think.
Hey, Brooke, another thought I have is, and that bullet point, training necessary for all organizations. Could we get more specific when we're talking about organizations that potentially have the ability to affect change in this bucket? So obviously schools, who else, when you speak about the youth assistant program, who else is involved in that program, that kind of model that we could identify as an organization that needs training?
Yeah, and so as Chase and I were talking through this, we were thinking a lot too about law enforcement and different organizations that work with youth. It's so different in every community. And so we wanted to be careful that we weren't being prescriptive about a program, but more letting
Right.
communities kind of have that conversation about what that looks like in their community.
Yeah, yeah. I think maybe just giving some ideas might be helpful.
Mhm.
If I could jump in, this is Bethany. I would just say, so one of the programs that we've been funding over the past couple of years is Peace Learning Center's restorative practices training. And the reason I bring it up is that they were doing it with schools. School teams were receiving the training, and then they had actually a number of community organizations reach out to them wanting that same training. And so it was places like YMCA's or, different after school programs or locations that work with kids outside of school, but who wanted to align those practices with the schools as they were learning them. And so I don't have the full list of the types of organizations that reached out, but I would say we could kind of look at that group of organizations, and those would be suggestions maybe for communities who aren't sure who could, which organizations would be good to target.
Mhm. Thanks, Bethany. Any other thoughts or comments about this bucket?
I'll echo what Rachel said about youth voice. I would love to have youth perspective, maybe who have experience in like the discipline policies and practices, and kind of get their perspective on the effect of zero tolerance policies, but then also what does a successful restorative discipline approach look like? And what does that feel like from a youth perspective?
Mhm.
And Brooke, for some reason, the only other word that kind of keeps resonating in my mind in this conversation is trauma-informed.
Mhm.
I don't know where we would work that in terms of the bullets, but I think it does speak to the opposite extreme of the zero tolerance kind of philosophies.
Mhm. All right. Well, moving right along, we'll look at our last bucket, and that is really whole child education. And so, we talked about this in our last group meeting, talking about framework for social emotional supports for schools, helping schools kind of put a framework in place. And then not only having a framework, but also some implementation support. So it's one thing to have this wonderful framework, but school employees are very busy. And so having someone to be able to walk alongside and kind of provide that type of implementation support, we believe would be really helpful. And then, like I said earlier, funding for additional support positions that can provide some of the social, emotional, and mental health supports that students need in schools was another kind of bullet in this bucket. So I love Leah's point about academic achievement and making sure that we're making that connection. And I think we can maybe wordsmith some of the bullets a little bit, but I'm interested in everyone's thoughts on this last bucket.
I would say it would be probably wise to put some language in there around intentional collaboration with parents and guardians. I think that similar to, restorative justice and some of the other things we've talked about, I think there is some misinformation out there and some, I think people very much about their children and want to make sure that they are that the parents are connected with what's going on with them. So maybe some intentional outreach, education, in collaboration with both teachers and parents on, what do these terms mean? What does it look like? How can they be involved? And truly, I mean, the biggest impact will occur if and when the parents are on board with and implementing similar strategies in the home as we're trying to do in the schools with the kids.
Could you add that to the second bullet, implementation support for schools, teachers, and parents, or schools and parents / caregivers?
I love that idea. I think that makes a lot of sense.
I do too, Rachel. In terms of funding and positions to support this work, like I'm all on board for this, as you know, this is my wheelhouse, but I think all of these are great recommendations. I think when we're talking about funding and positions, that can mean a lot of different things to different people. Sometimes, leaning on federal funding or state funding, or even asking local schools to use their funding. What kind of different funding frameworks are we proposing are our best? And it might depend on the community, and then in positions, what positions do we think are most impactful to drive this work forward faster?
So as Chase and I were talking, we definitely were discussing how it would really depend on the school and the community and the supports that they felt like they needed. And so we didn't necessarily want to be extremely prescriptive on that, but I think maybe being more specific around positions that support, we said support this work, but maybe we'd be more specific, student support positions in some manner. Does that help, Jess?
Yeah, I think so. Student support positions. Yeah, because you're right. It is going to look different in every community, as we've found in Project Aware. But I think those student support positions are really important because that point person to provide training, whether it's to parents or to educators, there's just a huge gap right now. There was a lot of momentum when it came to professional development around social and emotional learning, but there just needs to be so much more because it's almost like there was a first wave of like, what is social and emotional learning? Or what does it mean for educators to help students with their social and emotional wellness? It was almost like the first round was what? I think schools are really struggling with okay, what does that actually look like in terms of implementation? And that speaks to that second bullet point, but that there's still a ton of training that needs to happen in our state, which is maybe why we have misconceptions, as you mentioned, Rachel, is because people are guessing. They haven't really had an opportunity to truly.
I love the addition of including the parents in this, because I think that is another reason, like to your point, right? They don't understand it, or they feel excluded from the conversation, right or wrong. I go back to the whole child education, and I know that this is probably nitpicky with the words, but again, the context of how that's been received. And sometimes I think it's about just communicating the why. Is there a way to talk about the why instead, so that the label of this bullet becomes more about helping our youth succeed in school and life, or in academics and life? And I just raised that as a potential consideration, understanding that this document ultimately will go to the legislature, who is hearing a lot from various stakeholders and parents and community members. And if we can help reinforce the why, that might be useful.
Mm-hmm. Does anyone else have thoughts around that?
I understand it. I think we also are lacking data that supports the why in Indiana. We often have to point to, federal or national data that supports whole child education. And from a state level, we are lacking data. So I don't know if that's a point that we want to include. Funding for data collection.
No, I think that, I mean, I think that's a good idea, that whether it's, you know, even piloting funding for data collection somewhere in Indiana that can allow us to better understand the why and reinforce that.
We could just consider looking at that third bucket and saying funding positions and resources around data collection. Is that what would you support something like that, Jess?
Yeah, having a point person is always very helpful. The other thing I was thinking about data collection, and I was actually having a discussion with a coworker about this today, is that sometimes correlation and causation are hard in this space. It's not as clear cut as academics are. So we would first have to define kind of, well, what data are we collecting? And can that actually point to outcomes and point to us needing to implement this and dedicate more resources to it? Throwing out a lot of big questions that I don't have answers to. So I apologize, but it's something that's on my mind.
Yeah, I think the data collection gets a little tricky because you're exactly right. It's very hard. It's not as clear cut. And that's true for all data collection around mental health. I feel it's difficult to collect data to show outcomes at times. But I agree that having our own statewide data to be able to support some of this work would be important. Any other thoughts on whole child education?
I do. I just kind of want to second the idea of coming up with a phrase, and I don't know what that is right now, but a phrase that might be more, feel more clear for folks and have what's coming up for me. And I've always been terrible at naming things, is something around like, I don't know, like adulthood prep, or I'm sure somebody has a better term out there for it, but something around preparing like youth for the next, transitioning to the next stage of life or something. That is really, what it is. And I think, I think there's a lot of parents that can get on board with the idea of teaching kids soft skills that will help them be successful in their career. And that really is what this is. And I just kind of think about the conflict between the misinformation and the phrases that have gotten connected with that. And I definitely don't want to be misleading, but I sometimes, maybe even if we're more specific and step away from some of the academic terms, it might help it feel more clear for folks. So I'm sorry that I'm kind of giving a vague suggestion, but I think it does make sense to take some time to look at that.
Maybe that could be an action item from today's meeting that committee members think about. I just, as you were talking, Rachel, wrote down preparing students for lifelong success, or preparing children. But maybe
I think that's very good.
Yeah, maybe we could think a little more on that. And if you wouldn't mind sending Chase and I your thoughts or ideas on. Oh, was somebody saying something?
I put myself off mute, but this is Jess. We've been talking about this pretty much all week, and we'll continue to talk about it next week. So I think it's really important that across, whether it's across agencies or across individuals and professionals that are working in this space, that we're all using the same language. So yeah, as we are talking about that and kind of running some ideas by our agency leadership, I can definitely communicate that to this group if that's something that you all are thinking about.
Yeah, and if there's anything in the works that is already doing this, there's no, I don't feel like we need to reinvent the wheel. I think it is very much about clarity, and I feel like, you know, the old phrase about where information stops is where imagination begins. I think that's what we're seeing right now happen, and yeah, I'm just wondering how we might be able to be more clear. But yeah, if there are things like this that are already underway, we're happy to join those, or, you know, help or wait or whatever makes the most sense.
I certainly would love all of your help. I think a cross-sectional perspective on this is really, really important. So I will definitely run those by you and solicit some feedback.
I actually read an article just this week that I can send to the committee around the term social emotional learning and the perception. So I would love to send that to everyone in case it would be helpful in us in this conversation.
Yeah, that would be great.
All right. Well, does anyone else have any other questions, concerns, comments about this last bucket? All right, it looks like we lost Donna. Well, so then lastly, Chase and I wanted to kind of prioritize these three buckets and have a little bit of a conversation around prioritization. You know, what do you all see as most important? And also, you know, what do you think is going to be maybe something that is a little quicker, that can be done quicker, or what do you think will take kind of the most time? Let's start with prioritization. So as a committee, what do we feel is our highest priority with these three buckets?
My thought is that it would be access, and I'm speaking specifically to, well, a number of things, but specifically to insurance parity. I think that this is where we could get some real legislative support potentially for insurance parity for children who have commercial insurance and are on that cusp where the services aren't affordable. So I think that's something that in terms of where it would be good to throw our proverbial weight around a little bit, I think that might make some sense because, you know, we can set all these frameworks up long, but if children can't access them, then, you know, then what does that look like? And then I think for me, gosh, these are all so important. I think I'm kind of leaning on both. I don't know. I'm having a hard time choosing between the discipline approaches and the social emotional supports because I feel like they go so closely hand in hand. I think maybe discipline, as I'm externally processing here, is taking the lead only because if we don't discipline students appropriately, we exacerbate disparities, we exacerbate trauma, and we further marginalize kids that are already at risk. And you know, if we don't get that under control, then access to the social emotional supports, you know, the people that maybe need it the most are out of school anyway. So that's kind of where my head is now, and feel free for anybody to push back or rearrange on those.
Welcome back, Donna.
I apologize. I got kicked off, but I'm back.
You're fine. We're just prioritizing these three buckets. So Rachel's proposing they stay in the order that they're in with access being the highest priority for this group. And then maybe we say something along the lines of proactive and collaborative approaches to, not exactly sure if we want to keep discipline in there, but something of that nature instead of the models of restorative discipline approaches and then the whole child education, however we might change that.
Thank you for recapping.
Of course.
My my public health beating heart really wants to look more upstream, but I very much think that access right now, in light of kind of widespread trauma over the past year and a half, I think is, especially Rachel, if you feel like there's some wiggle room there and potentially some opportunity for movement, I think that that could be a really impactful thing right now, while we dedicate time to more, restorative discipline and social emotional supports to look more upstream and be more preventative.
I concur. I like the order they're in as well, or would agree that the order they're in as well, from my perspective, is appropriate when you ask the question of most important.
I support that.
The other thought about the insurance stuff is if there is any sort of legislative movement to help with that, it's something that will take a significant period of time. And I think there's things arranged both on a federal and state level that, I mean, it's a heavy lift. So I think that is certainly not our low-hanging fruit. It is something that we have an opportunity through this commission to put some real weight behind it. I think that's cool.
I even wondered, with the flow of COVID relief dollars coming through the state from the federal government, if there isn't an opportunity to try to leverage some of those dollars to help open up or to help fill some of the gaps that exist. And I think we recognize that the need is greater given COVID and the impact it's had on our youth.
Mm-hmm.
I think what gets a little bit tricky is, this is kind of a sidebar. What gets a little bit tricky is insurance billing rules. So if a person is being reimbursed at all through Medicaid for something, then you cannot, through Medicaid, offer a service for free to somebody else. Otherwise, Medicaid has to be the lowest payer, from what I understand. So, and we do have, through our block grant, some dollars dedicated to serving youth in Indiana. So that is something that is prioritized, but I'm thinking specifically, I'm getting kind of stuck on the kids with commercial insurance that need services.
So Rachel, that's such an excellent point. And I'm wondering, as we were talking, I was thinking about, so in our community, we noticed this gap from like outpatient to inpatient, especially right now. We're seeing like a lot of students. I didn't get that. Could you? Sorry, my watch started talking. A lot of students struggling to return back to in-person instruction. So whether that was students who have been virtual since March of 2020, and now they're coming back to school, but just that gap in services. And also, I think sometimes our community mental health centers are prevented. They can't provide that support because of, and we just lost Rachel, of what Rachel was just explaining. And so I'm also wondering, and maybe Bethany, you can kind of weigh in here too, but like, outside of our community mental health centers, there are a lot of individuals supporting the mental health needs of students in our communities, whether those are, different nonprofit organizations or private practice practitioners. And so I'm wondering too, if there's an opportunity for us to explore their ability to support their community in a different manner, if that makes sense.
I think you did touch on something that is, in my mind, a little bit of a, I'm trying to think of the right word. It's a question mark because, you know, from our standpoint at the state, the community mental health centers are the public, you know, mental health safety net that we have purview over, that we kind of oversee. And as you mentioned, there's plenty of other providers that are serving youth and families in the communities across the state. We've talked about this question within Project Aware, you know, and within school and community-based programs in general, how to know who all of those providers are. And so then when you even get into the billing and insurance aspect of that, it's a whole other ball of wax. And so I don't know if I answered your question, but it's certainly something that I think is an important piece of the puzzle if we're talking about access to services.
Mm-hmm. Welcome back, Rachel.
Thank you. Sorry, my computer kicked me off of Zoom and I'm trying to figure out what's going on with it.
Well, we were just talking about, you know, you mentioned community mental health centers not being able to provide services for free that that Medicaid covers. And we were just talking a little bit about the different groups that serve our youth and communities outside of community mental health centers, whether that's private practice practitioners or nonprofit organizations, and how we could even give communities the opportunity to work together and identify how they could create programming and support for students.
So I believe that is a rule for anyone that bills Medicaid, that if you're accepting Medicaid dollars, you can't, in the same, like as an example, if I'm doing group therapy, I can't bill Medicaid for 3 of the kids and then provide the other 7 the service at no cost. What you can do is workarounds, like using grant dollars or, you know, other sorts of things like that to make it work. But that's just a consideration as you're building it out. So we could, as an example, dedicate X amount of funding toward these certain sorts of interventions or groups or whatever, and have it just be, you know, the participants are all participants and nobody's having to bill anything to get it done. And that would be a very easy way to have a workaround around it. Does that make sense?
Yeah, I think kind of what I was thinking about was like who in communities who would have access to that grant funding, let's say. So would it only be able to be accessed through the community mental health center, or could the community consider like, well, maybe the community mental health center can't meet that need, but there is maybe a private practice or a nonprofit organization that can meet that need and support that work.
Yeah, I think that's definitely an option.
I think we just need to be careful to make sure that whoever would receive grant dollars would be held accountable to the same standards for clinical work and documentation. If we're talking about a clinical service, you know, it gets, the community mental health centers are held to a very high standard. We're audited by everybody under the sun. And I can see a lot of not-for-profits being very happy to get grant money, and then you're not really sure exactly what those services might include, or do you see what I'm saying? I think we just need to make sure that we don't hand out dollars to people who aren't going to be able to deliver the right service.
Yeah, I totally understand that, Donna. And I think you're exactly right. I used to work in community mental health. I know I actually was the clinical director at the old organization I worked at. And so I know the auditing and all of the standards that community mental health centers are held to, but I also wouldn't want that to be a barrier for children that don't have access in that way necessarily, or the community mental health center that is in their area can't provide the support in some fashion. So is everyone in the group good with the prioritization of just leaving them in the order that they are?
Yes.
Yes.
What's that? I guess you weren't unmuted all the way.
Yes, I'm good with that.
Was that a yes?
Yes. Do you want to, maybe if anyone disagrees, speak up.
All right. Well, I'm gonna, I think, following this conversation, I think it would make sense that our co-chairs kind of pull back together, Chase and I, and maybe some of our DMHA folks, and kind of make some edits and some shifts to the bullets and the buckets a little bit, and get those sent out to all of you. I'm going to lean a little bit on Bethany for a conversation around our next steps for this group.
Yeah, I think you kind of touched on it. Exactly what maybe I would have said, which is that, Elaine and I are here to capture what everyone is saying. So we will get everything consolidated, all the additional pieces that everyone has mentioned today. I do think that not all of it necessarily needs to go into our first run of recommendations to the commission. Anyone can chime in and say how they feel about that, but kind of consolidating it into our main points of our recommendations for the full commission meeting in September. And then I think, like you said, Brooke, if we kind of get that into like the final wording and share with the group, and then, get some, if there's any tweaks that we need to make after that, we can do so before Brooke and Chase present our recommendations in September to the full group. So does that timeline sound okay to everyone, or that kind of next step sequence work?
Sounds reasonable.
Okay, so then, we will get the notes consolidated, and I think what we can even do is kind of get, and Brooke, we can hear from you if you have any final thoughts on this, but get some kind of first drafts of what the kind of full statement recommendations will be. It sounds like everyone's pretty on board with the buckets that we have and what we've identified as our top priorities. So it's just kind of getting that final wording down for you to present.
Sounds great.
Yeah, and then, go ahead.
No, go ahead, Bethany.
I was just going to say, because then that kind of in turn determines our sort of next steps as a subgroup after this September commission meeting. And so we want to open to see if anybody has thoughts on, the number of times we feel this group needs to meet again, to maybe kind of hone in on some of the maybe gray areas of the, intricacies of each recommendation that would kind of flesh out each one of those, in the final report.
I would think after you send out the minutes, I would think that much of that might be able to be done just via email, because I think from what I understand, the final recommendations don't have to be fully fleshed out with, a decided upon plan. It just has to be clear enough that people who aren't familiar with it understand the general direction of what we're recommending. But we absolutely can meet again if people would like to.
Well,
and just to be clear, I was mentioning additional meetings for after the September meeting, not that we would have to convene again before September. Just wanted to be clear on that.
Got it, Bethany. Thank you.
All right. Well, then, if everyone is comfortable with that, we will work on maybe a final draft of these buckets and get them out to all of you for comment prior to our meeting in September. Which I was just thinking, as you mentioned that, do we have a meeting scheduled in September? It's probably on my calendar and I just don't know. What is the date? Does anybody know off the top of their head?
I can look real quick. I have my
Okay.
calendar here, and if I'm not mistaken, is it still the plan to meet in person in Indy? Is that the large group that you're referring to, Brooke?
I believe so.
This
My
is
guess
Elaine.
is that will end up being virtual just with the Delta surge that we're having.
Right.
Um,
I have September 29th as the date for that larger group meeting.
Me too.
Yeah, it was going to be at the NDI, but I'm looking that will probably change, unfortunately. Yeah.
That's going to be my guess. We've tried to pare down our in-person meetings as much as possible just to keep people safe.
Right. Well, if that is, I think we've really kind of went through all of our goals for today. So I appreciate everyone's participation in our meeting today, and you'll be hearing from us soon.
Thank
Thanks
you,
for
Brooke,
meeting,
for your
Brooke.
leadership.
Of course.
Thank you.
Thanks.